in pain.
There are new theories of addiction, and addiction has to do very much with what we become dependent on for all kinds of reasons, whether it's childhood trauma or current states of loss of job, depression. So people can be addicted to consumerism, and they are, hoarding, screens, addiction to food, addiction to alcohol, addiction to drugs. Addictive behavior is a root thing that we have to look much more closely at in our society, a root cause for why we take on these behaviors to self-soothe or self-medicate. It's not about heroin or cannabis or alcohol or opiates. Those are all horribly harmful, can be harmful things. But addiction itself, we have to start looking at the nature of addiction. And Gabor Mate, check him out. He does a TED Talk. He's wonderful. There are a couple of really good medical people who have been doing some good research on root causes of addiction. Check them out, and I'd be happy to talk to you about them. We got resources on the table about them. But let's get to some other questions, please. No, it's not. No, it's infused products are not strain specific. You'll see some on the shelves that are, there's, Blue Dream or whatever, but it's really, that's not the nature of infused products. Infused products are candies, tinctures, anything that's not smoke, okay? And infused products are what I recommend as medicine. So if you get an infused product, and let's say you find a 1-to-1 tincture, that's a nice ratio for insomnia, and you take, say, a half a dropper of a 1-ounce dropper, which is usually the baseline we start with, you take it, and you get to sleep, but you don't stay asleep all night. Then you play with your dose. You might take a whole dropper. And maybe it's not working for you. Maybe the 1-to-1 ratio isn't right for you. You want to get a little bit stronger, a little bit more analgesic effect from THC. You can increase THC minutely without getting high. But you're going to play. See, so it's so.
Tinctures are made from the same type of strain as possible.
No, they're made from lots of different strains, but that strain isn't the. No, it's really not about strains. Is like leftover from hippie days. It's really about the chemical components of the plant. And the essence of what I'm saying to you is your decisions to change to a different kind of herbal medicine or increase or decrease your doses could be based on how you feel. Is it working? Are you achieving the results you need? One of my favorite stories about this was a one-night thing. This was, again, dealing with insomnia. One of our patients, her name is Mary. She's 75 years old. She has chronic insomnia. She came in and she said, I can't get to sleep, but if I do get to sleep, I can't stay asleep. It's driving me crazy. But my next-door neighbor, Grace, came in and got one of your THC suckers. And she sucked on it for just 30 seconds, letting it go through the membrane of her mouth. And she slept like a baby all night. I want one of those suckers. And I'm like, Mary, slow down. Let's talk about how it's individuated and your metabolism might not be the same as Grace's. Certainly you could take a sucker, but really go low, go slow, be very careful with it. Have your everyday detox tea with you in case you get a little bit too high. And she goes, okay, great, just give me the sucker. She goes home that night. She sucks on it the same as her next door neighbor, Grace. 30 seconds. Puts it back in the Ziploc bag on the table next to the bed. Sleeps like a baby till 3:30 in the morning and then wakes up higher than a kite. It's like, whoa, this is not what I wanted. So she does what I said, flushes her liver out with water, takes some everyday detox tea, puts on a funny video. She gets through it. The next night, being scientifically minded, she sucked on it for 10 seconds. This is her second night trying. Slept like a baby all night. She came in to Dragonfly the next morning. I found my dose. She was all excited. I said, great, that's great. You found your dose. Stick to that dose. But be very conscious of how your body's going to adjust. You might have to increase or decrease that dose. So you see what I'm saying, sir? This is the bad news about herbs. How do you self-titrate? That's a tough one. How do you self-titrate smoking? Like I said, it's great symptom management, but ultimately, if you're talking about long-term healing, you want a medicine that you can self-titrate the dose scientifically. It's like when I advise patients who are doing THC oil for cancer or other things, I say, let's be real scientific about this. You got to put this little tiny dot, the size of a head of a straight pin, on your finger, and put it on your on your tongue and then see how you feel to see if you've got the right dose. So you might have to do the next dose a little bit bigger or a little smaller. How are you going to remember what the size of that dot was? Get your iPhone out and take a picture. You know? And really, you have to be fully scientific about this, and it's tricky. For me, I take something called Focus. It's a 1-to-1 ratio every night before I go to bed. I sleep wonderfully all night, and what I like best about it is I wake up really sharp and clear in the morning. And it's a 1-to-1 ratio of THC to CBD, but it doesn't get me high. When you're talking about, always remember, microdose your THC, and you don't have to get high. This particular formula is a formula that was suggested by the Dalai Lama's monks in their monastery in Tibet. They've used it for centuries to help people calm their minds so they can learn to meditate. And it's nothing woo-woo. It's nothing really magical. It's angelica, gotokola, a few other herbs that we already know about. It's a particular formula that we grabbed hold of, infused a 1-to-1 ratio of CBD to THC into it, and ended up with this wonderful, wonderful tincture that helps people with anxiety, insomnia, lots of stuff like that. Now, different people might need more than half of a dropper, which is what I take. Dosing becomes the second question, you know. Yes.
If one was prescribed for insomnia, could it have an anti-inflammatory effect also?
Well, the CBD certainly has an anti-inflammatory effect, yeah. But I take, remember I got rid of my arthritis with the 25-to-1 CBD to THC, and I started with 4 doses a day. Then as I got better, I took to 3 doses a day, then 2, then 1, and now I'm down to half a dose a day, anti-inflammatory. Now, if I have a bad day, let's say I play softball on Sunday afternoons. Monday, I'm kind of like, oh, then I'll take a little more. But there's no psychoactivity. So you get to play with it that way, you know.
Do you have raw product tested or do you have the tinctures tested?
No, it's you want to do both. The ideal, and this industry is in flux right now, so nothing's in place. The labs aren't in place like they're supposed to be. There's a lot still happening. But the ideal is you test your raw materials when you harvest, and you test your infused products after you've manufactured at both stages. Anything else? Other questions? Yes.
When you're making the tincture or whatever you're making, does the product have to be decarboxylated?
Some are decarboxylated, some are not, and it depends on the extent of the expression of the THC-A to THC that you want to have happen. With the THC oils that we're using, those are decarboxylated. They're very high THC, and again, you go low, go slow, very, very, very tiny microdosing. It's a good thing there's a lot of ratios, but you start with what are you treating? So if you're treating, again, something that's a neurologically based condition like epilepsy, Parkinson's, dementia, Alzheimer's, although that you want to introduce THC because of the role it plays with amyloid plaques. Epilepsy, Parkinson's, MS, neuropathic, you want to be in the high 20-to-1, 18-to-1, 25-to-1 CBD to THC. If you're dealing more with the mood disorders, bipolar, anxiety, insomnia, then you're going to bring the ratios down so that you get more of the THC analgesic relaxing effect relative to the CBD. Does that make sense? Yes.
You keep mentioning anxiety. How about depression? Can you use it for that? I haven't heard it, the word.
Depression? Yeah, you know, with depression, is funny because it presents differently in different people. With some people, there's a mania involved. With some people, it's like they can't function. They just sleep all the time. It's just like, you know, so different people present differently. And it's really important that people get professional help to talk about what's the root of your depression. What's going on in your life? What else has to happen? And how can you help combat the sort of the way that depression can present itself in all the ways of your life? Are there ways that you can help be kind to yourself with massage and good nutrition, etc.? And then in terms of using cannabis for depression, I think it's very tricky, and I work very closely with every individual's particular story about what's the delivery system that we're going to consider here. How much are you going to try? Are you going to be using CBD? Sometimes has this great calming effect for people who are anxious. So, but depression's a funny category. I can't say. Yeah, it's very tricky.
Anxiety, and they kind of wonder
Suzanne, yeah.
Do you do one-on-one consultations?
Absolutely, I forgot to say that. Please pick up my card and I can do phone consultations with you. It's free. This is my passion. This is what I want to do.
So how would you know where to purchase some of these products? All these dispensaries are coming up now, and, you know, I wouldn't know what was a better product.
Exactly. It's a big problem. This is why I go around doing these presentations, so that you can walk into any dispensary, and whether they are knowledgeable and can help you, guide you or not, you have some rules to look at the labels, to look at the ratios, to look at the infused products that they offer. You have something to go by. Oh yeah, everybody should get, if you're 21 or over, now you can go buy anything as of January 1st. But when the state gets its act together, you'll still need a 215 recommendation for medical products, then they'll be marked M, and recreational adult use products will be marked with an A. That's the plan, but there's been a lot of hubbub in Sacramento about that not being a feasible plan, because they can't figure out how to tell what's... Right now, you don't need a medical card to go into a dispensary. You just have to show your ID, show you're 21 or over. We do have a list of doctors who give 215 recommendations, is what they're called, medical recommendations. You can call Dragonfly at 707-962-0890, and we can share that list with you.
Thank you so much.